Good morning, everyone. I'll call this meeting to order. The meeting is for the Standing Committee on Public Accounts. I'm Laura Lee Nicol, the chair of the committee. I'll remind everyone to have your phones on silent, and I will ask the committee members to introduce themselves, beginning with the member to my left.
Good morning, everyone. Trevor Boudreau, the MLA for Richmond.
Good morning, everyone, and welcome. Tom Taggart, MLA for Colchester North.
Good morning, everyone. John A. McDonald, MLA for Hants East.
Good morning. Welcome. Melissa Sheehy-Richard. I'm the MLA in Hants West.
Good morning, everyone. Susie Hanson, MLA for Halifax Needham.
Good morning. Susan LeBlanc, MLA for Dartmouth North.
Good morning. I'm Braden Clark. I'm the MLA for Bedford South.
Nolan Young, MLA for Shelburne.
Thank you. And as is customary, there are members from the Auditor General's office here with us, and I will ask my legislative counsel to introduce himself.
Good morning, Philip Grassi, Legislative Counsel.
And to my right, Legislative Committee Clerk.
Hi, good morning. Kim Langell, Committee Clerk.
Thank you, everyone. So on today's agenda, we have officials with us from the Department of Community Services and Department of Municipal Affairs and Housing with respect to the review of social support programs. And I'll ask the witnesses to introduce themselves, beginning with the member to my far left.
Hi, good morning. I'm Cathy Cox-Brown. I'm the Executive Project for Housing Lead for the Rent Supplement Program.
Good morning. Byron Rafuse, Deputy Minister, Municipal Affairs and Housing.
Hello, I'm Tracy Embrett. I'm the Executive Director of Child and Family Wellbeing for Community Services.
Maria Medioli, Executive Director of the Disability Support Program.
Good morning. I'm Cathy MacIsaac, Associate Deputy Minister with the Department of Community Services.
Good morning. I'm Suzanne Lee. I'm the Executive Director of Employment Supports and Income Assistance with Community Services.
So welcome, everyone. I understand we'll get opening remarks from beginning with the Associate Deputy Minister MacIsaac.
Madam Chair, committee members, thank you for inviting me today to talk about social support programs offered by the Department of Community Services. Accompanying me are Suzanne Lay, Executive Director of Employment Supports and Income Assistance, Maria Medioli, Executive Director of the Disability Support Program, and Tracy Embrett, Executive Director of Child and Family Wellbeing. At Community Services, one of our main goals is to help our clients develop increased resiliency and self-sufficiency. And we recognize that the inflationary pressures we're seeing across the country and around the world have been making life harder for many Nova Scotians. Over the past few years, there have been increased investments in all aspects of our department, and we are growing and enhancing the programs and supports we offer. For example, we are transforming the disability support program so that everyone has choice and equal opportunity to participate and find success in their community. We have made significant investments to increase the number and range of options to address homelessness. We are redesigning the foster care system and investing in prevention and early intervention programs key to helping families at risk. In addition, the government has taken strong action to help those living on low incomes. Most recently, we've announced annual indexing of income assistance, a new funding stream to support income assistance clients with a disability or serious medical condition, which will benefit more than 60% of recipients of the Employment Support and Income Assistance Program. And we are providing a one-time $150 payment for each income assistance client who does not qualify for the new disability supplement announced in November. At the same time, our employment support program offers a variety of opportunities to help our clients build the skills and experience needed for work. We also know that investments in our young people are essential to breaking the cycle of poverty and building a stronger Nova Scotia. We provide a continuum of supports to help youth build connections to community, transition into post-secondary education, and attach to the workforce. We are also improving supports for young people leaving the care of the minister. DCS has created the PATH program that supports young people as they take their first steps to independence and building their futures, including ongoing financial supports and connections to supportive people and programs. It's important to note that all this work involves multiple government departments and service providers. We are very, very grateful to the staff and service provider partners in communities across the province for their dedication to serving and supporting their fellow Nova Scotians. We recognize there's more to be done, and we will continue to work diligently with all our partners to identify and implement further measures to help Nova Scotians. Thank you.
Thank you. And now we will go to Deputy Minister Rafuse for opening remarks.
Good morning, Madam Chair and members of the committee. Chair, I understand the committee is interested in learning what we're doing to help Nova Scotians address the issues of affordability and the rising cost of living. Together, we will do our best to address your questions. Chair, as you know, there is immense pressure on housing across the country, and unfortunately, we are no different here in Nova Scotia. Chair, we know that the main cure for housing crisis is more homes, and we know affordability improves when supply improves. The Premier has been clear in his instructions to the department. We need to do more to get more housing built faster, and that work is happening. We created a strong, clear housing plan with solid data and backed with historic investments that will help create the conditions for an additional 41,200 units over the next 5 years. While new housing supply is being constructed, we continue to enhance other program supports to help people with affordability. We also look forward to learning more about the additional opportunities and programming supports that may be forthcoming to Nova Scotians through the recent federal budget. In the meantime, rent supplements are one way the government is helping to cushion the impact of rising costs for Nova Scotians in core need of housing. Year over year, we've continued to significantly expand this program, with federal contributions have not kept pace. The annual investment in the rent supplement program between the years 2021 and 24-25 has grown 523%, from $11.1 million to $69.2 million. At the same time, the number of households that we've assisted had grown 174%, from 3,100 to 8,500. Chair, I would also like to point out that all new rent supplements are portable, and that means the supplement is attached to the person, not the landlord. This means that recipients can keep the benefit when they move. This empowers recipients, giving them more choice and control about where they live. We are also investing in the preservation and growth of affordable housing in the community housing sector through programs like the Community Housing Infrastructure Repair Program, the Community Housing Growth Fund, the Community Housing Acquisition Program that helps nonprofit housing organizations to acquire existing rental housing and preserve it at affordable rental rates. Nova Scotia is also building 222 new public housing units, the first major investment in 30 years, so that up to 522 more people will have a safe place to call home. A further 25 modular homes have been deployed to quickly provide 2- and 3-bedroom units for up to 88 low-income and Nova Scotians. In total, these investments will provide 247 homes to over 600 people. Chair, our home repair and adaptation programs are also a significant help to seniors and low-income households by providing financial assistance to make urgent emergency repairs, health and safety-related repairs, as well as disability-related modifications. Chair, this year the budget for this program stands at $23.8 million. Around 2,250 more homeowners will be assisted through home repairs and adaptation programs this year than in previous years. I will conclude in saying that I know everybody in this room shares the vision that for a strong future where all Nova Scotians have a safe, affordable housing that meets their diverse needs. Thank you, and now I'll be happy to take your questions.
Thank you, Deputy Rafuse, for your remarks. And we will open the floor now to questions, starting with the first round for 20 minutes with the Liberal Caucus. And I acknowledge MLA Clark.
Thank you, Madam Chair, and good morning, everybody. Thank you all for being here. I wanted to start with a few questions I believe probably best suited for ADM MacIsaac, and then if there's someone you want to direct it to, please do that as well. Around the issue with pallet shelters, which I think we all agree is a very important project. I know that just last month there would have been a site opened in Sackville, and I'm just curious, there have been some delays in terms of initial timelines. You know, we were told originally they would be up this winter. That's just passed. Obviously we didn't meet all those goals, so I'm just wondering, is the department confident that when next winter rolls around in a few months' time, will all the pallet shelters, the sites, be open and accessible and ready for people who need them at that time?
Associate Deputy MacIsaac.
I will ask Ms. Lay to provide a bit more detail, but I will say we are quite confident. There's a lot of activity happening now on this file. I'll note that pallet shelters are one aspect of the wide continuum of supports for addressing homelessness, but specific to pallets. I'll ask Suzanne if that's okay.
Ms. Lay.
Great. Thanks so much for the question. As ADM MacIsaac mentioned, pallet villages are really one piece of the work that we're doing in the housing continuum and the supports that we're trying to provide for folks that are experiencing homelessness. As you mentioned, we have one village open now in Sackville, and Beacon House is our service provider on site there. They're doing really incredible work supporting the folks that are in pallet villages. We've heard, or in the pallet village, we've heard some really great stories of individuals, for instance, who were sleeping rough, then moved to the Forum for emergency shelter, and then were approved to move into a pallet at Beacon House. And so certainly that individual is now on a path to greater stability, to greater independence. At Beacon House, they're able to access things like employment supports, wraparound supports. They've got a mental health clinician that comes in 5 times a week. They've got lots of workshops happening with reachability. And so again, really excited about the work that's happening there and the part that pallet villages will play in the housing continuum. And as ADM MacIsaac mentioned, lots of work is happening at pace to get the other units in the ground. So we know, for instance, we've got a village that will open in a number of weeks in Kentville, and Open Arms is our service provider there. Work is happening very quickly there, and we're also working with partners, as you would know, in CBRM, New Dawn, and the Ally Center to support individuals who are sleeping rough and experiencing homelessness in CBRM. And we're having regular and active conversations with HRM and others to plan where the other units will go. So very confident, and I would say an incredible amount of partnership on this project. Folks like Nova Scotia Power, Halifax Water, our service providers are really all coming to the table, bringing everything that they can to make things move as quickly as possible, prioritizing the work. So very confident and hopeful and excited about the role that the pallet villages can play in our work.
MLA Clark.
Thank you, Madam Chair. So how many pallet shelters are open today, and how many is the department expecting will be open by the end of this calendar year?
Ms. Lay.
So there are 19 open currently. We have, as I mentioned, a number. We've got 20 coming in Kentville in the next couple of weeks, 30 to 35. We're just finalizing the plans in CBRM, and we've got conversations happening in other places. We fully expect the entire 200, which we've purchased, to be built by the end of this calendar year.
MLA Clark.
Thank you. And is there, perhaps this might be premature, I'm not sure, but are there plans to purchase additional shelters, or how will the department determine is 200 enough? Do we need more? How does that decision-making process play out?
Ms. Lay.
Great. Thanks again for the question. So as I mentioned, again, pallet villages are just one part of the work that we're doing in supportive housing and emergency sheltering and providing supports to those experiencing homelessness. So you would know we have emergency shelters, winter shelters that are opened across the province. We also have pallet villages play one part of that role. We have tiny homes coming online in Sackville later this year, as well as a large amount of supportive housing units. So we know currently there are 693 units in Nova Scotia, and 524 of those have been built since fall of 2021. And we plan to do much more of that this year. So in terms of the question of how we determine what's next, we're continually working with our service providers and with our partners at the municipality and other parts of government to understand what the need is, understand where folks are, what their needs and experiences are, and how we, together with lots of other folks, meet those needs depending on where they are in the housing continuum.
MLA Clark.
Thank you. Thank you, Madam Chair. Also wanted to ask about income assistance and indexing. So obviously, we're happy to see that income assistance has been indexed. That's something that I think there's been agreement across the board that this is something that we need to do. So congratulations to the department for doing that. I think it's a good thing. Obviously, the one-time $150 payment, substantial increase to disability clients as well. So that's all very positive news. I don't want to downplay that. Nevertheless, obviously, income assistance rates are still very, very difficult, and in most cases, almost impossible for people to live on, given the cost of living pressures right now. So, inflation might be 3% or so right now in Canada, and forgive me if I don't have it exactly right, but I believe a single person on income assistance might be receiving somewhere in the range of $600 some odd dollars a month. So 3% on that might be $18. And I don't mean to minimize it, but I just want to give a sense of the scale here. So was there consideration of increasing the monthly income assistance rate, which has been frozen for the last 3 years in this budget? And if obviously that decision wasn't made, are there plans to bring that forward in future years to make sure that the most vulnerable continue to get the support they need?
Associate Deputy MacIsaac.
So it was agreed, wonderful to see the indexing be approved and come on board, and we're looking forward to the implementation of that in July. It'll be retroactive to April 1st, so those payments will come along, as well as the $300 you referenced for individuals with disability or serious medical condition, and then the $150 one-time payment, which has been, similar payments have been made in the past as well. We are aware that, as I mentioned in my opening remarks, there's always more to do, and we're always looking for initiatives. Income assistance, there is the standard household rate and base rates, but our caseworkers do work very closely with individuals for other supports, if it's special diet or transportation or other needs that would supplement the basic income. In income assistance rates, but there are also other programs as well across the department. Later on, maybe we'll talk about the PATH program, which is helping young people leaving the care of the minister with financial support. So we're always looking at a range of options that would be helpful to low-income and vulnerable Nova Scotians. So we'll continue that work.
MLA Clark.
Thank you, Madam Chair. Are the indexing, the one-time payment, the increases to disability clients as well, are those changes sufficient for income assistance in your view, or are we still, I don't want to say not meeting the goals that we should, but are those changes sufficient in the department's view, I guess?
Associate Deputy MacIsaac.
I think what I would acknowledge is there's really been unprecedented investment in supports for low-income Nova Scotians in all of the programs that I just referenced. So I would certainly say we'll continue that work. We'll continue to look at other supports that we can provide. And again, want to acknowledge the hardworking staff across the province who are working one-on-one with clients in order to try and meet their individual needs. So there's broad programming and then trying to support individuals as well, specifically with their needs.
MLA Clark.
Thank you, and I'd like to move over to some questions to Deputy Rafuse and the team from Housing now, if I could. Ms. Cox-Brown, I'm happy you're here because rent supplements is a big issue, a very important topic that I'm very interested in. And I'm just curious, obviously, as we all know, the INCA or the thresholds for eligibility for rent supplements were changed from 30% to 50%. And I'm just curious, does the department, and I know it's a federal, provincial funded program, it's not all provincial dollars, but does the department have discretion to change that threshold back to 30%? Does the department have the authority or ability to do that, independent of budget constraints? But does the department have the basic ability to do that if it chose to?
Deputy Rafuse.
I'm just going to give a high-level question. I'll hand it off to Cathy, who can give you specifics to your questions. But you need to should recognize the tremendous investment that the province has made in rent sumps over the last a number of years. As I noted in my opening remarks, a tremendous increase in total funding and a tremendous increase in the amount of people that it touches, we are now well exceeding our obligation under the federal program to cost match this program. We are now in, I think, like a 5-to-1 ratio or something like that. So the specifics for any questions, I'll hand it off to Ms. Cox-Brown, but we will continue, as we always do, look at all our programs to find ways to refine those and make policy changes which we believe better address the needs of the recipients.
Ms. Cox-Brown.
Hi, thank you for the question. It is a federal program, is what we have, even though, as Deputy has said, we pay a significant amount of money towards it. It's based on federal requirements, this program. The reason for the switch from the 30% to the 50% was to meet people in their deepest need for the program. It is a targeted housing program, so it was to target people and their biggest need. To do that, we've also had to increase. I mean, last year we increased the program by $22 million, and we had an extra 1,000 red supplements. This year we're increasing it by $17.2 million for another additional 500 red supplements. Any change to the program would require federal approval.
MLA Clark.
Thank you. So just to clarify, to make sure I understand correctly, if the minister or cabinet or whomever said, decided we want to move the threshold back to the 30%, which is where it was, a year and a half, 2 years ago, that change, the province could not make that change independently. The federal government would have to approve that. Do I understand that correctly? Or
does Deputy Rafuse or Ms. Cox-Brown? I acknowledge Ms. Cox-Brown.
All policy changes we submit to the federal government for their approval. Yes.
MLA Clark.
Thank you. So when the threshold was changed from 30 to 50%, was that a decision initiated by the province, or did the federal government come to the province and say, we want to make this change, or how did that actually come about?
Ms. Cox-Brown.
Actually, it was before my time, but I'll tell you, yes, it would have been initiated probably from the province, but would require federal approval before it could be ever implemented.
MLA Clark.
Thank you. I appreciate that clarification. And another issue related to rent supplements, which, as I said, I agree is a good program, and I know the province has invested a lot more money in over the last few years, so I recognize that. But an issue that I've raised in question period, I've talked to the minister about, I think he's aware of, other members have done the same as well, is the issue around average market rent in terms of calculations. So I think it can lead to some distorted outcomes where the average market rent number doesn't correspond super well with reality on the ground. So there was a constituent of mine, a woman who had, I believe the average market rent number she was told was $1,400 or something like that for 2 bedrooms, and you're looking at $2,200-$2,300 easily in the area. So I know the minister, we've talked about this, it's a CMHC data set, I guess, that's drawn from, but is there any ability to refine that? Can the province get its own data? Can we break that data down into smaller sets so that it's more tailored to a neighborhood or a community? Because right now, I think that the numbers that get spit out do not reflect reality, and therefore I think some people are being denied because of numbers that I think are a bit out of date and not relevant for their actual circumstances. So I just wanted to get department's view on that issue.
Deputy Rafuse.
So first I'll comment about using the use of average market rates. And as I said earlier, the province will continue to look at all of our programs to see where we can make refinements to better meet the needs of the recipients of those programs. The use of average market rent has been raised by yourself and others that maybe it needs to be looked at, and we are looking at that. the resolution to that might, in some instances, actually surprise you as to what it means to the individual. But as we work through that policy, we'll endeavor to improve it. I'm going to ask Cathy to talk about the details around how that rate is used. But we're not contemplating on getting into the business of developing our own database of our markets rents to be used. CMHC is a good source of reliable information. They have the ability to gather this information. It is updated on a periodic basis. They have access through their surveying to data that we would not have. It is accurate, although it may seem counterproductive sometimes, but it takes into account the results of the surveys that individuals have submitted. And so it is reflective of the average market rate in that area. You can argue maybe some of the geographic areas could be broke down further, but the province the size of Nova Scotia, it's really tough to do that and have that to be statistically accurate on a smaller, with using smaller sample size, because this is a sample. So no, we're not going to be looking at any other source other than CMHC. A lot of our programs are tied into it, but the use of how the area market rate can be reviewed and will be reviewed. So I'm just going to ask Ms. Cox-Brown to talk a little bit more about how it is used in the rent supplement program.
Ms. Cox-Brown.
Hi. Again, the AMR is a federal requirement, and as the deputy has spoken, the AMR is based on new and existing rentals as well as vacant and ones that are full. And it is a very scientific, proven kind of survey. So how we use it in the calculation of eligibility, because it's 50% of AMR for in our eligibility calculation, and we use it in the calculation that it's 50%. We do your AMR, and then we minus 30% of your income, your gross income, and that would be your contribution, and then we pay the rest to the client in that. It has increased. We do increase it annually based on the most latest survey. It has been significantly increasing by 12%, and by we're estimating 10% this year. So what we have seen, the results is subsidies are increasing because of the increase in AMR. In 2021, the average subsidy was around $300. It's doubled now, and some of our programs, the average subsidy is in the $700 range, and that.
MLA Clark with almost a minute.
Excellent, thank you. And I just quick clarification, and I think Ms. Cox-Brown, you might have mentioned it, but how often is that CMHC survey updated? Is it annual or?
Ms. Cox-Brown.
Thank you. Annually.
MLA Clark.
Great, thank you, Madam Chair, and I think I only have a few seconds left. So I appreciate the data set. I think, if at all possible, if it can carve out, and I take your point, Deputy Rafuse, on sample size and applicability, but I think if we can be as surgical as possible, if I can say on that, I think that would be helpful, because I think there are some discrepancies that exist despite good intentions, obviously, of the design of the program and the data set. So with that, I'll turn it over to my NDP colleagues.
Let's go to the next 20 minutes of questioning with the NDP Caucus. I acknowledge MLA LeBlanc.
Thank you, Madam Chair, and thanks to everyone for being here. I wanted just to start by saying thank you to the people at the table who I have lots of contact with or have had lots of contact with in the past, and I really truly appreciate your ability to take calls about constituency issues, and so I just want to start there. It's really helpful. The latest person I've been in contact with is Ms. Lee, and I just wanted to ask two questions about the Pallet program. Number one, and this is because I truly don't know this answer, but who where does the buck stop on the approval of where the pallet shelters go? Is it DCS or is it Housing and Municipal Affairs?
Ms. Lay.
Thanks for the question. So do you mean which department is approving where the locations are? So it is primarily a DCS responsibility, but we work very closely with our colleagues at Public Works. We are not engineers, and they are, so they have expertise and help us determine, for instance, the size site. We have we get advice from them in terms of access to services like sewer, water, electricity, obviously working with Nova Scotia Power and other partners like that. We come at it from the perspective of how close is it to services, how accessible is it to transportation, how willing, do we have a service provider in a local community that is willing to work with us, and what population, what model would work in the location. So really lots of things go into determining locations for where a pallet village, or really where all of our work happens. And so at the end of the day, it is a DCS, under DCS's portfolio, but we do it in partnership with lots of others.
MLA LeBlanc.
Thanks, that's very helpful. I was going to ask you, what do you look for in a site? But so you've said most of it, but I just want to clarify the services part. Like when you say access to services, besides the, sewer and water and power, what kind of services should be nearby or accessible to folks living in pallet villages?
Ms. Lay.
Thanks for the question again. So, and I was remiss, I missed a partner in my first answer of who works with us and who helps us determine location. So municipalities also play an important role. Certainly we, I mentioned in an earlier answer, have lots of conversations actively happening right now with HRM in terms of where the other locations will be in HRM for pallet villages. Your question around what other types of services. So we look for things like access to transit. So how, can folks who are living in the village get to a bus or to other points of transit to be able to access other services like other service providers, healthcare, things like that. We'll look to things like food. So is there accessible food for village residents? And of course, we'll bring resources to bear if there isn't a lot in the immediate area. So we, of course, at Beacon House, our first operational pallet village, there is also a shelter on site with a kitchen where folks come in and cook once a week for all of the residents of the village and of the shelter. So what we need to provide there is a bit different than if in another location where we would bring meals in, for instance, if there weren't accessible meals on site. We look for things like we talked about water and sewer, really making sure that folks have dignity in where they're living. I think we sometimes get asked about locations, and sometimes it comes with the idea of putting people as far away from other people as possible, and that's certainly not what we want. We are not in the business of warehousing people. We want people to be part of communities and have access to services just like all of us would want.
MLA LeBlanc.
Great, thanks for that. So we've been concerned about the essentials rate for people who are unhoused or living in shelters, which is about $380 a month, I think. I'm wondering if Deputy or Associate Deputy Minister MacIsaac, you can tell us how many individuals are currently receiving that rate in the province?
Associate Deputy MacIsaac.
If it's okay, I will ask Ms. Lay to respond. She would have that level.
Ms. Lay.
Thanks for the question. So I don't actually have the number of folks who are receiving essentials right in front of me, but we can follow up. If I don't find it in my binder by the end of today, we can follow up with that answer. And just about essentials, really, as you mentioned, when we're looking at somebody for income assistance support. We look at household type, we look at type of accommodation, we look at how many people are in the family, and the standard household rate that somebody receives really depends on all of those things. And folks in temporary accommodations, be it hospital, shelters, as you mentioned, they receive an essentials rate of $380 a month. And really, part of what we look at are the other resources that folks have access to if they're in those places, and the cost of those things compared to somebody who's renting a house and that kind of thing. That being said, our department always looks at cases. If there are questions on an individual basis, we're always happy to look at things like special needs and assessing how we can help individuals and clients.
MLA LeBlanc.
Yeah, well, I see, like, I remember when the essentials rate sort of came in or got a little boost a couple of years ago, and it makes sense to me that if someone is housed and having all their meals provided, that perhaps they don't need as much. But we're talking, now. Many of the people who are getting the essentials rate are living in tent encampments, and have zero services except for the goodness of the people in the neighborhood's hearts who come and bring meals every once in a while. So there's a major difference in some of the situations, and I wonder if there's a look to that. I'm wondering also if the department has done any work on estimating the annual cost of increasing anyone on essential rates to the standard household rate. Has any of that calculation been done?
Ms. Lay?
So there were two questions there, and if I can go back, Emily LeBlanc, to maybe it wasn't a question, but a statement about the folks that are sleeping rough and living in tents. And just want to note that there are some resources available for folks through our outreach team. So we've invested with Shelter Nova Scotia in more coordinated outreach, providing some supports to folks that are sleeping rough. And where it's appropriate, we have options for folks to come in out of the cold. We know that the Forum still has room, for instance. And as we build other pieces that are coming online, like supportive housing, 902 Man Up is opening some new supportive housing in the coming weeks that will also open up some capacity in the system. So I would encourage folks, if it's an option for them, to come inside. Your question about estimating essentials. So we are always looking at how we can improve our programs. Certainly, I think the investments we talked about earlier in terms of the indexing, the disability supplement, those are all evidence of work that the department has done. And so we're always looking at how we can further support our clients.
MLA LeBlanc.
Great. If you have that calculation when you're looking through things, that would be great. But considering indexing income assistance rates only cost $7 million this year, the cost of raising the rates would likely be pretty low. So I guess my question is, what is the rationale for leaving the rates? I take your point that people are getting provided services, but let's face it, like anyone living on $1,200 a month is living a pretty hard life. It's pretty difficult to survive on that, let alone $600, which is the standard household rate for someone, a single person, let alone $380 for someone living in a tent. I mean, I think we have to acknowledge in this room that none of that money is enough, and that it was never enough, and now it's especially not enough because of the rising cost of living, where cheese costs $8 for 400 grams or whatever. Like, it's just impossible. So I just hope we can all acknowledge that. And I guess so my question is, what is the rationale for leaving those rates, the essentials rates, so low?
Ms. Lay?
Thanks for the question. So as I mentioned, we're always looking at how we can improve our programs and improve the services that our clients, the resources that we bring to bear for our clients. Any decision around increasing any rates would be up to government through the budget process.
MLA LeBlanc?
or the additional appropriations process. Don't always have to wait for budgets. We all know that. Even the Liberals did it outside of a budget process when they increased all the rates by $100. Even with the $300 disability supplement, those receiving income assistance will still, I've already said this, will still live below the poverty line. Was there a discussion in the department to simply increase the income assistance rate up to the poverty line so we don't have the $300 extra for people with disabilities and, you know, all the different sort of categories? Has there been a discussion to just simply bring up the amount, like the bottom amount to the poverty line?
Associate Deputy MacIsaac.
I guess I would point to the decisions to index and add the disability supplement and other spending investments to support individuals on low income as an acknowledgement that we want to do more and that more has needed to be done. And as we've stated, that we will continue to look for opportunities to provide additional supports. We don't stop that work. We're always looking at those.
MLA LeBlanc.
Does the department track the average rental cost for income assistance recipients year over year?
Is it Ms. Lay? Ms. Lay.
Thank you for the question. I don't have that information in front of me, but we can follow up with you.
MLA Clark? LeBlanc?
Sorry, you don't have the actual tracking, or you don't know if you track?
Ms. Lay.
The latter.
MLA LeBlanc.
Well, here's my supplementary question for either answer. So if you do track, and this is for following up, can you tell us the average rental cost for the recipients this year compared to last year? And if you don't, how can you ensure that recipients can afford to pay their rent? I would suggest that most of the folks that we serve in our office who are on income assistance struggle to pay their rent, even if they're in deep core housing need and they get the subsidy or the subsidy. People are struggling to pay all the bills and make all the ends meet. So I want to ask one more question. And then I'm going to turn it over to my colleague. We understand that income assistance recipients can also receive support for security deposits when they move into new apartments. Are there limitations to that program?
Ms. Lay?
Thanks for the question. That is another piece I'll have to follow up with you on. I know we have access and can support when folks are able to secure housing, need a deposit. In terms of what the parameters are and if there are upward limits of that, I'm not certain, and we'll have to follow up.
MLA LeBlanc?
Yes, I think for sure there used to be, because it was this, before the standard household rate, there was this idea that we won't give you a deposit for more than this because it suggests that you're living above your means, as it were. So anyway, it would be good to know where that is. But I'm wondering also if there are additional supports for income assistance recipients transitioning from being unhoused to housed. So of course, if someone's unhoused, they've probably gotten rid of anything that they had when they were housed, like beds and furniture and that kind of thing. Is there extra money available for someone to set up a new apartment when they are able to be housed?
Ms. Lay?
Sure, thanks so much for that question, actually. So as you mentioned, there are supports for folks when they need things like a damage deposit, things like that. And yes, there are supports for individuals if they need to purchase additional furniture. For instance, if somebody needs a couch or a bed that they don't have. We also have lots of wonderful service providers who are on the ground working with clients. Typically, if somebody is unhoused, an advantage of them being connected into the department and into a housing support worker is being able to connect them with other resources, whether it's DCS income assistance or whether it's things like all of the other resources that service providers bring to bear in supporting folks in that transition.
MLA LeBlanc?
Okay, it would be great if we knew also, when you're following up on things, if you can find out if there's a cap to that. So like up to $1,000 or $200 for a bed, but then you have to go to Parker Street for everything else or whatever. Last question, I promise. When individuals transition from homelessness into an apartment, what's the process for switching the individual from the essentials rate to the standard household rate? And is the change immediate or is there a lag time?
Ms. Lay.
Thanks for that question. It's a question I asked early in my time here at DCS, and I understand it happens quite quickly. So an individual just needs to reach out to their caseworker and can be switched fairly quickly from essentials into standard household rate, and that's also when they're able to access other things like a deposit for their new housing. And again, hopefully that person is connected in with a housing support worker and some of our other service providers who can bring other resources to bear as well.
MLA Hanson with around 4 minutes.
Thank you. So my questions will be directed to Department of Municipal Affairs and Housing. The last time we heard an update, there were over 7,500 Nova Scotians on the wait list for public housing. Can you speak to the average wait time in this stance?
Deputy Rafuse.
Certainly I can, and just let me pull that up while we're talking. But you're right, the wait list does stand around 7,300 is the number we're working right now. So to give you a sense of what the average wait times, I can give you the provincial and then also broken down by region for you if you like. So right now, in Metro, the average wait time on the list is 2.3 years. In Cape Breton is 1.4 years. Western is 1.9 years. Northern 1.9 years. And if you average that out over our wait list, the average on the wait list is 2 years on average across the province.
MLA Hanson.
Thank you, Madam Chair. From our understanding, women and children fleeing domestic violence are prioritized on the wait list. What is the average wait time for this specific demographic?
Deputy Rafuse.
Certainly, they are prioritized. We have a number of types of cases that would be put on our priority list, and I would be remiss in saying that those wait times that I mentioned to you, on average, have gone down over the last couple of years as the team in public housing is working tirelessly through our turnaround time to make units more available more quickly. That reduces the wait time list, or the time on the wait list. Sorry. It also you need to recognize that sometimes units are vacant for a significant time as we do a rehabilitation between tenants and the like. But we are endeavoring, and we do metrics on turnaround times that does allow the wait times to go down. So currently, as you mentioned, there are types of individuals on prior lists, and those experiencing family violence are one of them. Others include people that are homeless, those in need of sustaining health services, and people that are inadequately housed. They're basically our priority listing. Right now, as of the end of December the 1st, there's 151 applicants on our priority wait list. The average for the priority list is approximately 1.4 years.
MLA Hanson with less than a minute.
Okay, so I'll just skip through. It was great to hear that our Premier recognized that gender-based violence is an epidemic in this province, but to date, we have not seen epidemic levels of funding to address the pressing matter. Can you provide us a timeline or when we can expect to see greater levels of funding to support women leaving abusive partners, especially as it relates to housing? So I'm basically saying, is there a possibility of creating something on the side of a stream that is specific to domestic violence or gender-based violence, so that the priority is not a year. I mean, the wait list is not a year, 0.4. I understand that you're working extremely hard to get units back up, but I mean, when we think about, the...
Sorry, it's order. Now we will move to the PC caucus for questioning. Who's going first? I acknowledge MLA She Richard.
Thank you, Madam Chair. I knew it was me, but you didn't know it was me, so sorry about that. I just want to change gears a little bit, and I noticed during estimates, lots of hours to listen in and tune in and learn things, that there was a substantially big increase this year in the budget. So I was wondering if you could talk to me about what programs might have saw some of these increases receiving the funding, and maybe some of what those key priorities and investments were.
Associate Deputy MacIsaac.
As I mentioned earlier a few times, there have been some really, I would say, historic investments in some of the programs, and investments in all our programs, but some really substantial, life-changing investments. For example, to implement the human rights remedy, that is really a generational change in the way we support people who have disabilities to live in the community and thrive. We continue to make investments in foster care redesign, which is providing additional supports to foster families and supporting children who live with foster families into becoming integrated in part of a really solid family in the community. We also, again, for the income assistance program, have the $300 a month disability stream, which does benefit 60% of the clients who are currently served by that program. So there's been some very substantial investments. Any one of my colleagues here could speak in detail about any of those if there was one you wanted to follow up on.
MLA She Richard.
No, that's those are good notes I grabbed from there. But I just want to also ask about our CAs are more engaged when they're working in the casework, and sometimes MLAs aren't as connected, simply because we're maybe other places or not the first person that answers the phone of the call. So when we talk about employment and support services, I know that they're important, but can you kind of explain in more detail why that program is such a key to the fundamental parts of everything?
Associate Deputy MacIsaac.
If it's okay, I'll ask Suzanne to speak to that. That falls under her portfolio.
Ms. Lay.
Thanks so much. And thanks so much for the question. So I'd love to talk about this part of my portfolio, and really we're trying to do two broad things with our employment support services. One is to reduce the labor market barriers and help increase participation for income assistance clients. As ADM MacIsaac mentioned earlier, one of our goals is self-sufficiency and independence. And then the other piece that's really important for us is thinking about prevention and early intervention for youth who are connected to the department or who are at risk of connecting to the department, really trying to position so that we can break the cycle of poverty, that intergenerational pervasive kind of piece around poverty, and really position youth for success to get on a path of self-sufficiency. So we have a range of programs for youth and for adult clients on income assistance, and really act in kind of a continuum of supports. So it could be making connections for youth as young as 12 in community with service providers who are on the ground, who may never actually know that the program is funded by DCS, really trying to break down that stigma, to attach youth to programs that will help them gain skills and build independence. And we have really great programs supporting on a pathway to education, for instance, and the programs all build on each other. So we have really great stories of individuals who went through, for instance, our Career Rising program, which connects folks to employment in their community. It also, while they're making a wage working in the Career Rising program, it also has a fund that can bank essentially $1,200 a year for the individual to put towards future education. So if somebody goes through Career Rising multiple years in a row, you can go through 3 times in a summer program, you can earn up to $3,600 for your education. And so we see clients who go through Career Rising, and then they may attach to our Inspiring Success program, where individuals are actually hired by a government department and provided that public service experience. And then we have programs like Education Works that connects folks into education, and we pay 50% of the tuition. We pay 100% of things like health coverage and books and things like that. And so if somebody's gone through Career Rising and then going into this program, they've also got that education piece that they're taking with them into the funding piece that they've already earned into this program. And so we have great stories of individuals who have gone through each of those programs and then have come out at the end of that and have really great careers, social workers, CCAs, ECEs, lots of really good pieces there. And good stories where things like we've got 3 siblings who have gone through the continuum of supports, and then because the mom in the family, for instance, sees what her children are able to achieve, she's then been engaged with our employment supports programs and is on her own path to self-sufficiency. So really great stories of resiliency and kind of breaking that intergenerational cycle of poverty through our ESS programs.
MLA Sheehy Richard.
I'm particularly interested in changing gears a little bit. Well, not quite, but youth involvement and peer support. I mean, I have a great organization in Posse that does a lot of harm reduction training and peer support, reaching those in their place of need. Can you tell me a little bit about the history, like how EDGE program, like does that intertwine in there, and explain, again, learning session for me today, but explain the EDGE program and in that lens of peer support.
Ms. Lay?
Thanks. Thanks again for the question. EDGE is a really great program, and again, one that I'm always happy to talk about. So it started a number of years ago, really trying to bring different resources to bear for youth who are attached to IA or attached to the department, and it was built with youth and by youth, really taking that kind of human-centered approach so that folks are really getting the resources that they need. And it is meant to be a one-door approach, so youth can come in and access pre-employment supports, post-placement retention supports when they're and they're delivered, as you mentioned, in peer groups with individual mentorship kind of baked in. It's open to youth 18 to 26 who are job ready or job search ready or on that path. And it started with a handful of sites and now has expanded to 6 sites across the province with a new virtual option, I think just started last year. And again, really, it's about trying to help youth attach and be ready to attach to the workforce. So we're like bringing everything that those youth need to the table to get them there. And so really taking that holistic wraparound support approach, and again, it's delivered in peer groups with all of that mentorship kind of baked in. I mentioned Virtual Edge as one of the pieces we've added in the last year or so, and it's been really great to actually open up access to the EDGE program to folks beyond the physical sites. So we know, there were 24 participants last year in Virtual EDGE, and they span across the province in really rural communities. So great for them to be able to connect into the EDGE programs. Certainly, I think has increased things like literacy skills. So we're also, as part of the EDGE program, connected with GEO, an organization called Getting Everyone Online, which is helping to bring down those technology barriers for individuals who can, who need those extra supports to be able to attach digitally to our programs.
MLA Sheehy Richard.
I guess since it's expanded, and that was sort of where I was getting at, because when you get in rural Nova Scotia, it's very difficult. Like, there's not as many services, and it's hard to reach the youth, and that's why, like I said, I'm so grateful for the work that Posse does do in my community. I call them the experts of all things in that. But has there been a chance to have any feedback of how even a comparison of how they're feeling on the virtual. Have you feedback from the new?
Ms. Lay?
Thank you. Yes, so we do participant surveys after every run of the program, after every peer group, and certainly the feedback that we've received is very positive. Folks are feeling like they're getting the supports that they need, like they've got a safe space to come and learn and grow their skills. And I actually have the list of locations where individuals from the virtual program are located, and again, places like Crossroads Country Harbor, which I'm not actually sure where that is. It's in the northern region, but able to connect folks from lots of different places like Tuscott in the western region into the EDGE program and allowing them to connect and build skills in that way.
MLA Sheehy Richard.
So one more question on that. So have you made any changes from the feedback already, or is it working as planned?
Ms. Lay?
Thanks for that question. So always evolving and looking to our service providers to really, they're the ones telling us what the youth need on the ground. And so each program may look slightly different depending on what the youth actually need that are in each peer cohort. And certainly we're expanding the program so it continues to grow because of the feedback that we've received and how it's working and the success that youth are having coming out of the program.
MLA Sheehy Richard.
I just have one more quick one before I pass it over to my colleague, MLA Taggart. But so just so that I'm aware, because I think this is great and I've got someone in mind to send this way, is it a requirement of the program for income assistance recipients only, or is this for any at youth risk that might benefit from the program?
Ms. Lay.
Thank you. I believe both. Yeah.
I assume you're concluded now, and I pass it on to MLA Taggart.
Thank you, Madam Chair. And so my first questions are for DCS, and I guess I want to start by saying, you folks are doing a great job in a very, very difficult, a lot of very, very difficult situations that most of us don't really fully understand. But I want to either Ms. MacIsaac or Ms. Lay commented that they'd like to talk more about the PATH program, and I would love to hear more about that program, if I could, please.
Associate Deputy MacIsaac.
I will pass it over to Ms. Embrett for more details, but I will say that is a program that is one of those ones that we consider life-changing. So, over to you.
Ms. Embrett.
Thank you. Thank you very much. Very happy to be here today and very keen to talk about the PATH program. So I work in the Child and Family Wellbeing Division, which is a program previously referred to as child welfare. We are really trying to transform the services and programs that we have to focus on child and family and community and keeping families together. There are times when a child is not able to remain with their family, that if they've experienced abuse or neglect or significant risk of that, we will look to supporting them with other family members and in community. When a child does have to come into the care of the minister, we look for permanency and adoption. Unfortunately, that does not always is not always the outcome for some youth in care, and they may transition to adulthood from care. So we have recognized needs. Our legislation identifies a child in care is up to the age of 19. It can be extended in some circumstances up to the age of 21. So in the cases where young people transition to adulthood out of the care system, many of these young people face barriers, financial barriers, emotional barriers, housing challenges before they really have a chance to understand the steps they need to take to be successful as a young adult. So the PATH program was launched January 1st of this year, and essentially it is a funding and support program. So when a youth in the minister's permanent care and custody reaches the age of majority, either 19 or 21 if they are in a post-care and custody agreement, then these young adults no longer, previously, did not have any access to supports or services from the department. So the majority do not have an extended family to fall back on, like so many of us have been fortunate to have in our lives. And those natural extended supports may not be there for everyone. So in recognition of those challenges that these young people face, we created the PATH program. The goal of the PATH program is to ensure that eligible youth have equitable opportunities to access services, to support safety, health, and opportunities, as well as connection to community. So, as a youth transitions at the age of 19, there is a financial payment system. I'll talk about the financial piece first. There is a financial payment system where the youth, all they have to do is register with us, and we confirm that they were a child in permanent care and that they were in permanent care when they turn 19 or 21, and they are eligible for financial payments bi-weekly until they turn 25. So it's a 6-year window. At the age of 19, their financial payments, I forget the exact math, I think it's 700 or 800 biweekly, but it equates to $20,000 a year. There are no qualifying assessment for it. It is not income tested. It is not needs tested. So all children who transition from care to adulthood are eligible for these. In the second year of the program, the amount that they will receive is $18,000 a year. Then each year it decreases $2,000 a year until it's $10,000 a year when they're 24 years old. So the critical point about it not being income tested and not being needs tested is it's not considered taxable income or reportable income. So we have a technical interpretation from CRA that it is not reportable. So the offset of that as well is employment insurance. It's not income. It's not employment income, so it doesn't need to be reported for that as well. So a significant financial support for these young people. In addition to that, there's also Youth Outreach Plus. We have partnered with Family Services of Nova Scotia, a wonderful organization that provides a lot of support to individuals in need, and they will provide outreach supports to these individuals the entire time they are in the PATH program. They have set up a 24-hour phone line specific just for young people in the PATH program, and they can reach out for support, even additional supports. There could be some financial needs or situational needs, and we will work with them to ensure that these young people who don't have the safety net that a lot of young adults have, that we will do our best to work with the service provider to create that. There are check-ins every 3 months with Family Service Association for the first 2 years. I believe it's the first 2 years. And then after that, it would be every 6 months. So we just want to make sure the young people are doing well. It could be if they don't want to engage with Youth Family Service Association, they just need to have a quick phone check-in. Yeah, I'm good. There could be some youth who meet with them on a regular basis. It could be weekly, it could be virtual. Family Service Association has employees all over Nova Scotia, so there could be some in-person if needed as well.
MLA Taggart with 30 seconds.
30 seconds. Well, I thank you very much for that answer, and I look forward to continuing when our time comes around again. Thank you.
Thank you. And as the time comes around again for the second round of questioning, we have 13 minutes, and we'll start with the Liberal Caucus, MLA Clark.
said 13 minutes, Madam Chair? Yeah, okay, thank you. Deputy Rafuse, I just wanted to ask you about a recent announcement from the federal government of a new housing infrastructure fund, a $6 billion fund in total, $1 billion of which I believe is dedicated for infrastructure, pipes, and all of those components that are necessary when it comes to building new housing, and then the other $5 billion for housing support. And unfortunately, in my view, some provinces so far have expressed skepticism of this and have said that they aren't sure if they want to sign on to that program. I believe the deadline is January 1st of next year, so in about 7 months. And the federal government has said if provinces don't sign on, that funding will then go directly to municipalities. I'm just wondering what the department's view is on that program, and is the expectation that we will sign on with the federal government by the 1st of January of next year.
Deputy Rafuse.
Thank you for that. And yes, through a series of announcements before the budget and with the budget, the federal budget itself, the federal government did announce these programs. Clarity is the $1 billion directly to the municipalities for infrastructure, and the following amounts could be infrastructure money as well. The federal government has indicated a number of what they refer to as conditionalities to this money. They have not provided complete detail about those conditions. Some have been were spoken about in the announcements: adoption adherence to new building codes, the adoption of adherence to housing and infrastructure for housing. And as recent as last Friday, we were in conversations with the federal government, as all PD partners were, looking for further clarity on what those conditions will be and how those programs will work in conjunction with those conditions. Whether they are, a lot of them, as you may have read, may have sounded very familiar because they are existing programs that some provinces already have. Are they enhancements? Are they stacked? Are they replacements? Those types of details provinces need to have that clarity before we can recommend if the provincial government signs on. The federal government was not yet in a position to provide those details to us. They understand that they need to do so. They have indicated that January 1st sign-on date is a reality, and the reality is that is there because they want to flow money in this fiscal year. But they're not in a position to give us all the conditions nor how the programs work. So it would be impossible for us to say that we're going to sign on. I can tell you all the programs, we have great alignment with those programs, with the existing 5-year housing program that the province has previously announced. A lot of the programs, in fact, are ones we may have been given credit for doing so, and just further enhanced at a national level. So there is a great alliance there, but we just need clarity around those conditionalities and what they mean to us as a province.
MLA Clark.
Thank you, Madam Chair, and thank you, Deputy Rafuse, and that makes sense, I think. But just to clarify so I understand, the department certainly, at this point in time anyways, has not closed the door on signing off on this proposal by January 1st. You might not be able to say, yeah, we're absolutely going to do it today. I appreciate that. But it sounds to me, and correct me if I'm wrong, but it sounds to me like it's certainly an open discussion and the door is not closed on that front anyways.
Deputy Rafuse.
Certainly, that's how I'd characterize it. As I said, there's great alignment with a lot of these programs with our 5-year housing program. There are some conditionalities that like tying things to housing and infrastructure with align with our own thinking on those types of things. But we need to have complete understanding of what that means. As you said, the first $1 billion will go directly to municipalities, and that is problematic from a number of perspectives, some provinces more than others. because of the lack of clarity about whether or not when something goes directly to a municipality, is there an expectation for the province to participate in that? And does it align with our priorities? So we, as I say, we just need to have clarity on all those things. It is a great alignment with our program, and these types of investments, we would agree, are what's needed to expedite the housing infrastructure, the transportation corridors, and transportation system enhancements needed to address the housing crisis.
MLA Clark.
Thank you, Madam Chair. And I haven't seen this reported publicly, and Deputy, you may know, you may not, I'm not sure, but do you have any sense of what the dollar figure that Nova Scotia would be eligible for under this program would be, roughly?
Deputy Rafuse.
Certainly, you can do the straight math and get a percentage that we normally participate in, and I don't have that. I don't want to use that number for a number of reasons, because they haven't given clarity about whether or not the allocation will be done on a per province basis and the basis of that allocation. There are certainly some programs in there that are application-based, which are not allocated equally from province to province. As has been the case in the past, where under the HEF funding, our allocation was not indicative to our population allocation. So no, we don't have clarity about how much is coming to us, and that's the further refinement of details which the federal government needs to provide.
MLA Clark.
Thank you, Madam Chair. Thank you, Deputy Rafuse. Appreciate that clarification. Wanted to ask, go back to DCS here and just ask about the pallet shelter question again, because as we know, in some cases, there has been some pushback from local community members on this issue. I was dropping my kids off at the Sackville Sports Stadium on the weekend for swimming and skating lessons, and there's people there with signs, you know, which is not great to see. I would say, you know, it's unfortunate that happened. I know that there's also been some issues in Whitney Pier as well, up in Cape Breton. I'm just wondering, from the department's perspective, how do you learn from that experience? Because I think there would be there's always we talked about this yesterday in Natural Resources, there's always very broad support for an idea and a concept, and then when it's broad, and then when it becomes specific, sometimes that changes, right? When people realize that it may have an impact, real or perceived, on them, right? And that's a hard thing to overcome. So I'm just curious what department has learned from these first few experiences to hopefully in the future roll these out and get that. You're never going to get 100% buy-in, but to get the support level that I think is there, how do you deal with that issue going forward?
Associate Deputy MacIsaac.
I think I'll defer to
Ms. Lay.
Thanks for that question. Certainly in all the work we do on housing and homelessness, and supportive housing, we try to balance the need to move very quickly. You know, I don't think I am exaggerating when I say to move quickly to save lives in many cases, to provide folks a roof over their head, stabilization, and opportunity to kind of get back on their feet, balancing moving as quickly as we possibly can, to your earlier question about how quickly can we get things built, with the needs and concerns of communities. And certainly I understand that folks, when their community changes, they have questions, they have concerns. And so in all of the work that we do, and certainly what we've learned since I've been here for a couple of months, is really cemented in being a good neighbor and taking a good neighbor approach to the work that we do. So addressing concerns, for instance, as we can and as appropriate as they come up. We often hear from members about concerns in the community. We had a recent example, not with the Pallet, but with another, not with the Pallet Village, sorry, but with another part of our work, where there was a concern from a member about residents of a shelter smoking in a bus shelter, for instance. And so very quickly we took that back, had a conversation with the service provider. We were able to provide them with the resources that they need, and they're building a smoke shack kind of on their property. So it's things like that, trying to be really respectful and hearing concerns. Certainly in Sackville, you know, we've had conversations with Beacon House. They have built mechanisms that folks can reach into them. We've had conversations with our CMP and with others who are, again, not to exaggerate, I don't think, but characterize their responses as really pleased with the work that's happening and how folks are, as they're given an opportunity to stabilize and get access to resources and all of the wraparound supports that, you know, being on that path to permanent housing really helps with. But I get it. I understand that folks have concerns when their community changes. And so really trying to take that good neighbor approach of just like we all would in the places that we live. If our neighbors had concerns about something happening in our space, we'd take those seriously and try to be a good neighbor.
MLA Clark with about 2 minutes left.
Time's flying. I appreciate that, and I think that, again, I said this yesterday, we were talking about wind turbines, but same concept. You know, I think it's in human nature to be afraid of change and to be leery of things that you don't know, and speculation and rumor and all those things. And what can dispel that often quite quickly is reality, right? And having something on the ground and things happening. And I know the site, the village out there in Sackville's been open for, I think, over a month now. So that's good, right? People get familiar and then life goes on in the vast majority of cases. So I really appreciate that answer, and I think it's valuable as an example moving forward. Last question. Mentioned in the previous round that there was some space available at the forum right now. I just wanted to, how many beds are occupied versus available at this point in time there?
Ms. Lay?
Thanks. So it certainly can change daily, but as I understand, I asked the team this morning, there are 19 beds currently vacant at the forum. We also know there's capacity in other parts of the system as well. So there are beds available for folks to come in out of Sleeping Rough or have those opportunities. I mentioned also earlier we have more supportive housing coming online in the coming weeks. Certainly as Pallet villages open up, it will free up beds in the forum and in other shelters. We have a number of them across the city, as you would know, and in other parts of the province. And so, again, on that continuum, as we open up things down the line, it frees up space for folks to come in out of outside.
MLA Clark.
Thank you, Madam Chair. I presume I can't have much time left, so I just want to thank everybody for being here this morning. Doing very, very important work very well. And so I just want to thank you all for being here and for answering our questions this morning. Thank you.
Thank you. And we will now move on to the NDP Caucus for 13 minutes. And seems to be MLA Hanson is indicating it's her.
Thank you, Madam Chair. I'm going to go back to Municipal Affairs and Housing. So there are currently 11,202 public housing units across the province, and we know that most of our public housing units are quite old, with an average age of over 40 years. So I just have a couple of numbers that I wanted to know about, like how many of those units are currently out of use due to repair, and is there any public housing units beyond the point of repair? How many of those are?
Deputy Rafuse.
Certainly. So thank you for the question. Yes, there are some that are beyond repair, and we'll make decisions on those as we go forward. You would have noted that recently one of the modular units we were able to place in a location was to address a unit that was beyond repair through damage. Currently, our vacancy rate hovers around, I think around, let me find the exact number here, but I believe it's around 1%, or no, 3%. So that's due to turnover and the like across the board. And I just want to clarify an answer I gave to you earlier around the priority access list, why I had the opportunity. I gave you a rate that was for all our people, all access rates, not the people, individuals that are on the family violence priority listing. And I don't have that with me, but I can endeavor to get that for you if we track it by that subcategory.
Mm-hmm. Great.
MLA Hanson.
Thank you, Madam Chair. Thank you for that, Deputy Minister. So, as you had just mentioned, the modulars, some of the modulars that were created are replacing some of those old units that are not usable. So we know that there were an announcement of 247 public housing units, and you just explained that some of them will be replacing that. Is that the case with the 247? Do you think that that would be a fair number that will be replacing the units that are not repairable or disrepair?
Deputy Rafuse.
When we use that number, that is our net new number that we're using, so that we wouldn't count the replacements because they're already in our existing count. So the modulars would be new. So some of the ones we spoke about that had already been put in place would cover some damaged ones, but that 247 is our net new on top of the 11,200.
MLA Hanson.
Thank you, Madam Chair. So we've heard from service providers that applicants who are experiencing homelessness must include a signed support agreement with a housing support worker. Whether the applicant needs additional support or whether it's an affordability issue, they need this agreement, or the application will be denied. Can you confirm that that is accurate?
Deputy Rafuse.
So you're asking about people that are on the priority homeless list, or generally?
MLA Hanson.
Sorry. When they need to connect with a housing support worker for that agreement.
Deputy Rafuse.
I believe it is a requirement, and the reason is that when we have individuals, we work with our counterparts and our partners in community services for individuals that come into our public housing unit off of those list priority, the homeless list and the like. So there would be a requirement to say that they are attached to a support worker. It's not to be punitive, it's to make them more successful as they move into public housing units, because that is an environment, as you know, where if you don't have the supports and you're dealing with certain issues, then you're less likely to be successful.
MLA Hanson.
Thank you, Madam Chair, and thank you for that answer. Can you speak to the wait list for the Canada Nova Scotia Targeted Housing Benefit? How many are waiting to receive the benefit? How long is the average wait? And is there a priority ranking system?
Deputy Rafuse.
I'm going to hand that over to Ms. Cox-Brown.
Ms. Cox-Brown.
Hi, thank you for that question. To acknowledge, we did have a significant backlog, and beginning in 2023, we were in the 1,000 range, I believe, at that time. We made some significant improvements, mainly streamlining the process, building the capacity that we needed as well, and being nimble with our capacity, because moving our backlog from intake over to case, wherever we needed it, to move it back and forth. Did some clarity on policy to make it easier to process, as well as role clarity, so that we were removing a lot of duplicate work in that. So currently we have, in just the last February, March, we had about 800 applications just during that time period. We have about 555 that we are currently processing at this time. Intake is looking, last week, it was mid-March, I think March 15, that was last week. They're probably in the next week now in March. We do actually prioritize some of our housing support ones coming through that. They are prioritized. For example, we have applications in April that have been approved. We've received one last week and they are now inactive, receiving an active rent supplement. The timelines, I think we were quoting 2 months. We are trying to speed that up and bring in, we're actually planning to bring in more firm service standards to be able to understand where it goes. But it's very dependent on the completeness of the application. But we also brought in different process. If you're only waiting for your banking information, we'll process you now right to the end to speed up that process for the individual. If we are waiting for your banking information, but we know you're not eligible, we're not going to wait for that. We're going to let you know right away. So we've implemented those type of procedures as well. And I got to say, a lot of this credit is to staff. We reached out to staff and asked them, how could we speed up the process? What tools and supports you need? And so a lot of this, the improvements, I would say, is really to credit to that staff that are doing the rent supplement. But yeah, so.
Thank you. MLA Hanson.
Thank you. I just want to get some clarity on this. So I'm glad that there's been some changes, and obviously streamlining is really important because we know that a lot of folks were accessing this service. And what we've heard from housing support workers is that there's not a communication link between the housing support workers and the staff that are in your department, and they're not able to get answers for their clients, and so they're waiting the 2 months, and they can't actually find out what is happening with their clients' information. So I'm hoping that within that answer that you just gave me, that is something that has changed, being able to make sure that the communication is given, because when people are in limbo waiting 2 months to find out whether or not they can afford their rent, 2 months, 1 week, 2 weeks is a long time, right? So I just kind of want I want some clarity on that. Is that a process that's now working?
Ms. Cox-Brown.
Yeah, and I do believe that a lot had to do with the backlog that we were trying to address, a significant backlog. Yes, I agree. We realized we needed to improve our communications, not just to housing support, but our manager has been doing information sessions with trying to improve and understand how our program works. We're looking at other kind of approaches, plain languaging some of our guides. They're not always clear to our clients in that. Translation service, we brought that in as well. We're going to translate some of it just so we're reaching all. So it just makes it easier for everyone to access and understand. Because a lot of the delays also is understanding what information needs to be submitted. So we wanted to make sure that is clear. So we are focusing on trying to improve that. Also, not only we're trying to do a one-pager, a very simple thing that we could give to our stakeholders like housing support to understand clearly what it is. I have actually talked to the one who takes a lot of the phone calls, intake. It has decreased significantly even in that because we are speeding up and responding to clients, so they don't have to call, they already know. So we're noticing that just as well.
MLA Hanson.
Thank you, Madam Chair. I'm going to talk about the Canada-Nova Scotia Target Housing Benefit, but it's going to be in relation to DCS. So we know that it's classified as exempt unearned income for income assistance. Is the Canada-Nova Scotia Targeted Housing Benefit classified as exempt unearned income for income assistance recipients? If yes, is this a full exception or a partial exemption? If no, does this mean that income assistance recipients receiving the benefit have their rates reduced?
Associate Deputy MacIsaac.
We're going to have to go back and we'll absolutely get that for you.
MLA Hanson.
Do you want to? Okay, so I'm going to go back. Okay, no worries. Gotcha. All right, so this is going to go back to municipal affairs and housing. Sorry. Many who receive a rent supplement through the Targeted Housing Benefit Program continue to struggle with the costs. And so I heard earlier that, it's based on the CMHC rates, and you need approval to be able to change that through policy. I'm curious to know why it's not being calculated on a rent geared to income basis, because we know that it's such a challenge.
Deputy Rafuse.
Just a question for, well, first of all, yeah, rent geared to income is the model we use in public housing. It is, I would say, referred to as the gold standard for deeply affordable housing. That is a requirement, as you know, for all new participants or recipients coming into public housing is the standardized rent geared to income calculation. So that's the parameters of that program. A lot of our programs have different parameters, and I'll ask Ms. Cox-Brown to specify or speak to as to why we use the current model in the rent supplement program or the top-up program.
Ms. Cox-Brown.
Hi. The model that we currently use is 30% of their income is to contribute to based on using the AMR. The reason again, it's a federal program, that is the kind of the qualification and requirements. It is a partial benefit for rent, and it's just a federal requirement.
You have 17 seconds, MLA Hansen.
Okay, so we will have to continue this conversation offline, but I will say I truly appreciate the work that each and every one of you do up here. There are many conversations we need to have, and I think keeping that line of communication is really key to us being able to assess the need of our clients. Thank you.
I will now go to the PC Caucus with MLA Taggart.
Thank you again, Chair. Just to finish up on the PATH program there, just a quick question. At a very vulnerable age, as these young adults age out of foster care, and it's great what you're doing. Is there mentors? Is there mentors provided, like age appropriate, mentors? That's, I think, I just asked a question quickly. That's all.
Would that be Ms. Embrett? Ms. Embrett.
Thank you. Yes, we do have programs. Our prevention and early intervention programming supports families, children and families at the young age, before there may be involvement, during involvement that the department may have with children and families, and post. So we do have youth outreach programs that go up to, that provide supports, including housing support, finding employment up to the age of 24, and then our Youth Outreach Plus, specifically supporting PATH, is up to 25.
MLA Taggart.
Sorry, thank you very much. And so I'd like to, so on this, how does the department work with organizations to support low-income Nova Scotians towards like meaningful employment? What programs do you have there?
Ms. Lay.
Thank you. Again, great question, and thank you for that. And if I've got two answers, if I may, just very quickly to previous questions. There are about 1,200 people who are receiving essentials rate. MLA LeBlanc, I believe that was a question from you earlier, and MLA about 1,200, and MLA Hansen, no rent supplements do not impact income assistance eligibility. So to the question at hand, and thank you for that, really that goes back to the work that we're doing in our employment supports and early work around employment support services and early interventions. And again, so we're looking at a continuum of supports for adult clients, recipients of income assistance, and trying to do prevention and early intervention for youth who are either attached to income assistance or are at risk of attaching. And so we have a number of programs. We talked about EDGE earlier, things like Career Rising and YDI, which is a really wonderful program focused on youth and attaching youth in community to supports, trying to get them on a path to build skills from employment and self-sufficiency. And YDI is a wonderful, there are two kind of subgroups of YDI funding, one delivered by the Association of, or administered by the Association of Black Social Workers, focused on the African Nova Scotian community with a range of really wonderful projects and programs in that community to attach youth to skills and potential careers, and similarly with our Indigenous population with the Native Council of Nova Scotia, some really great programs under YDI being delivered there, all again with the intention of building skills and being on that pathway to self-sufficiency and employment, and breaking that cycle of attachment to income assistance. And if I can share with you a couple of I referenced them earlier, but I'd like to kind of dig a bit deeper, if I can, into some of the stories that I've heard since I've joined the department in terms of folks working their way through the continuum of programs and the impact that it's had on them and their families. So I mentioned earlier an example of 3 siblings who participated in our Career Rising program, and that's the one where over the summer with the connection to employment in their communities and gaining education funding as part of that work, they earned wages and earned that post-secondary contribution. 2 of the 3 siblings then went on to NSCC in the Education Works with Education Works bursaries in addition to what they'd earned through Career Rising. And we've heard recently from one of the siblings who finished the social services program at NSCC and another sibling who is a full-time ECE. And recently, the parent of those 3 siblings also engaged with ESS programming, kind of saw what their children were able to achieve in being connected, and is actually working in the kitchen where one of the siblings is an ECE. So again, really important work in there in attaching and trying to think of what a person needs and what the barriers potentially might be to attaching to the labor force. I have another, if you'll indulge me, another example that I think is just really lovely. A person who had attached to income assistance after an injury that they suffered. They were no longer able to work in their field, and really prevented them from being attached to the labor market. So in 2002, they started with NSCC and the Education to Work funding and some funding from Employment Nova Scotia through Labor Skills and Immigration. And then they did 2 summer placements in 2022 and 23 with government departments through our Inspiring Success program. And I heard from a colleague in another department who they had worked with. They had really tried to steal that person or hire that person after graduation. So they graduated with a diploma in business administration, and now they have a full-time job. They did not come to work for government, unfortunately, but they have a full-time job working with one of our NGOs, actually delivering one of the programs that DCS has to offer. So again, what I have learned kind of in my time here at DCS is we sometimes hear from folks who are at their most vulnerable, are not doing well, and we also hear from really great stories of resilience and how our programs are impacting Nova Scotians. And so while I've taken up some time, I appreciate the opportunity to share some of those stories as well.
Thank you. I believe we're going to MLA Boudreau now.
Thank you, Madam Chair. And this is, I'm not normally a member of the Public Accounts Committee at this point, and certainly I was asked to sit in today, and I didn't know what I was, what actually the topic was when I was asked, and certainly it's a great honor to be here with some people that I consider tremendous leaders and people who really are caring and compassionate and are doing some great work in the province. And no offense to municipal affairs and housing, but I just want to say, in my short time that I was minister, you understand how broad, how big the department is, and how much there is involved in the day-to-day operations there. And I will say, because we're so broad, it's hard to kind of get out the success stories. And we often hear a lot about kind of the challenges that are out there, but I will tell you, we have no greater people on this job than are there right now, and certainly not only the people here sitting in front of us today, but also, you know, our frontline workers, the people who are doing it every day to support Nova Scotians, mostly our most vulnerable Nova Scotians, and full credit to the department and to staff that are there. And if I had a whole lot of time, I would certainly ask a little bit more about the Mockingbird program and kind of all of the things and changes that have happened there. And I'd probably ask some questions about employment supports and the goal, you know, to get up to 35% of people on income assistance on, you know, employment support programs, and the great work that's happening there. And I will kind of go to Maria a little bit, because I know you've been sitting here eager to ask and answer some questions. And I'll put a broad one to you here, but there's a lot going on with the remedy. There's a lot of great work that staff is doing and building on that. Certainly we can talk about the disability supports, the $300 a month. That wasn't mandated during the remedy, but that our government said was very important to make sure that we're supporting all people with disabilities. But I'm giving you kind of the open floor, Marie, to talk a little bit about, you know, some of the hard work that's going on, some of the challenges, but lots of the opportunities that we have coming in that sector. So good luck.
Is there a particular question?
Well, what I would say is, you know, with respect to the remedy, there's a timeline, and certainly, you know, how are things going? Kind of what are kind of the next steps in terms of what our department or the department is doing in that realm.
Ms. Medioli.
Thank you, Minister Boudreau. I think you felt sorry for me, so for not having been asked a question. But thank you for the question, because it is a very exciting time for all persons with disabilities in Nova Scotia. It was unfortunate that we ended up with a court case, but it really, the end result is a new beginning, I think, for persons with disabilities across the province. We have a plan, a 5-year plan to remedy the discrimination, and it touches on many aspects of the supports that persons with disabilities need to live in community. And it will support those who are eligible for our program, but also those who aren't eligible. So it involves, there's 6 key directions. It involves closing the large institutions that exist in this province, and there are some large institutions where persons with disabilities live. And in fact, I'm visiting each of them over the next 2 weeks to talk about the plans for each of those institutions. And again, the organizations aren't closing. They already provide lots of supports in community. It's just the large buildings. But it's new opportunities for persons who really haven't had a lot of choice in their lives. And that's what it's really all about, is giving them the tools and supports to make choices about where they live, who they live with, and how they spend their day. So there is the institutional piece, but then there's the other supports, and those supports include additional staff, so we can get those caseloads down so people can engage in a relationship-based way with persons with disabilities in making their choices. It includes some supports in regional areas, because often a lot of the supports people need are centralized and they've been forced to move. So it's about making those supports available in their community so they can live in their community of choice, close to their family and friends. And also because when people live in institutions, they aren't able to contribute to their community, and they bring so much, the richness, the diversity of experience in life and perspectives. We're missing out when they're not able to live in community and share that with us. I'm thinking of some of the other pieces, the regional supports, and also some new programs. I think that's the other piece that are, you know, sometimes we design programs because it's like the system knows best. And I would say that the philosophy of the remedy is that persons with disabilities know their life, and their families also know their lived experience, and to give them the tools to design a way forward that makes sense to them and isn't dictated by the system. And I'll say one last thing, because I think that's the most important thing, is this remedy really is about the lived experience, and allowing those who have that lived experience, whether it's persons with disabilities or their families, to drive the ship, to make the decisions, to define their own future, to imagine better, and we're really just here to support them to do that. So thank you, Minister Boudreau.
And on that, you have 30 seconds, Emily Boudreau.
Yeah, so I'll just close by, that's kind of what I was hoping you'd say, and certainly highlight some of that, and the individualized funding and how that's going to shape how things change there as well. But I also would say, service providers, and we've talked a lot about them, but our service providers certainly play a key role in those connections that they have to the departments. And one of the things I heard loud and clear when I was there is...
Order. I just wanted to say that. I thank everyone here that came and presented as witnesses, and I want to ask if there are any closing remarks to let me know. None from Deputy Rafuse. Associate Deputy MacIsaac.
I will be very quick, but I did want to thank everyone for the opportunity to be here today to talk a little bit about some of the programs and services. We are trying to spread the word on some of the newer ones, for example, the PATH program, to hopefully get as much participation as possible. So we really appreciate it, and we're here today, but as been stated, we're really the face today, but there are hundreds of service providers and staff right across the province delivering on this work day in, day out, and we're very appreciative.
Thank you very much, and I know it was very informative for me to hear the comments and the questions. I thank the committee for that. So you are dismissed, and I asked the committee if they willing to take a recess at this time, and for how long? No? No need? Okay. Thank you. MLA LeBlanc. We're going to continue on with our meeting as our guests are leaving. I see a lot of indication, like, call me. So I thank you. So for the information, we have correspondence from the Nova Scotia Health, information requested from the March 27th meeting. Is there any discussion on it? Not seeing any. The next discussion, of course, is our June meetings, and the last meeting date for June would be June 26th, and we know that's a busy time with all the graduations. So we just wondered, do you want to hold a meeting on the 26th of June? MLA LeBlanc.
As much as I love this committee, I do feel like it would be great not to have a meeting that week because of all the different graduations at the different times. There's several that I attend in my riding, and it'd be much easier to postpone.
So there's a motion to postpone the June 26th meeting. Madam Clerk.
Here then, the last meeting would be June 19th. We would meet again until September.
That is what the discussion is now. Is everyone in agreement with that? If anyone wish to speak to it? No? All in favor? Contrary-minded? Motion carried. So on that, and so our next meeting will be May 1st, and that's an in-camera meeting with the Auditor General. And I guess I now say meeting is adjourned. Could be everyone's favorite part of the meeting.